You might think that a daily joint is just how you unwind. But what if the official guide to psychiatric disorders had a name for it? It's called Cannabis Use Disorder. And the line between casual use and a clinical diagnosis is surprisingly thin. So, do you know the 11 signs that separate a habit from a full-blown addiction? Let's break them down. I'm Dr. Sambo, a consultant psychiatrist, and today we're wading into some controversial territory. The conversation around cannabis is, to put it mildly, a war zone. To some, it's a harmless plant. To others, a dangerous drug. As is usually the case, the clinical reality is somewhere in the middle. Cannabis Use Disorder, or CUD, is a real diagnosis in the DSM-5. That's the manual clinicians like me use. This isn't about judging your choices. It's about recognizing a pattern of use that causes real-world problems or distress. And it's way more common than you'd think. Studies show that roughly 30% of people who use cannabis may develop some form of CUD. The disorder exists on a spectrum: mild, moderate, or severe. We're going to walk through the 11 official criteria together. Think of this not as a panic-inducing checklist, but as a mirror for self-awareness. Let's get into it. It's the classic, I'll just take one hit, that turns into smoking the entire joint. Or maybe it's promising yourself you'll only smoke on weekends, but that somehow bleeds into Monday, then Tuesday. You set a rule, but you consistently break it. This isn't a failure of willpower. It's a textbook feature of how addiction starts. This is the internal tug-of-war. You know you're smoking more than you want to. You tell yourself, after the stash is gone, I'm taking a tolerance break. But that break never quite happens. Or you set rules, only after 8 p.m. But then you start making exceptions for a stressful afternoon or a boring Tuesday. This sign speaks to the feeling of being trapped. You want to change, you might even try, but you just can't seem to make it stick. Addiction is a time thief. Think about it. The drive to the dispensary, the time spent scrolling through online menus, the hours you're actually high, and then the time you spend feeling foggy, unmotivated, or burnt out. When you look at your week, how much of it is dedicated to weed? If the logistics and the after effects are eating up your schedule, that's a huge red flag. A craving is not just a passing thought. It's a deep, gut-level urge that can completely take over your brain and feel almost impossible to ignore. Cravings can be triggered by anything: people, places, emotions, or even just the time of day. It's that feeling when you're stressed, bored, or lonely, and the loudest thought in your head is that getting high is the only thing that will make you feel better. For a lot of people, cravings are one of the toughest parts of this disorder to handle. This is when the consequences start to get real. Maybe your performance at work is slipping, you're missing classes, your grades are tanking, or you're just not as present as you'd like to be as a parent or a partner. This is often a sign that the people around you start to notice first. They might say you seem distracted or forgetful, or that you're dropping the ball. Your partner is complaining about you being high all the time. You're getting into arguments with family. Your friends are worried. And yet, you keep using. This highlights the isolating nature of addiction. The drug becomes more important than your relationships. You might find yourself hiding your use, getting defensive, or just avoiding people who give you a hard time about it. Remember your hobbies? The things you used to love? Hitting the gym, working on a creative project, going out with friends? This sign is about watching those things fade away because of cannabis. Maybe you skip your workout because you'd rather get high. or you turn down dinner plans because you know you won't be able to smoke there. Your world starts to shrink, with cannabis right at the center, pushing out everything that once brought you joy. This one is really dangerous. It means using cannabis in situations where it puts you or others at risk. The most obvious example, driving while high. A lot of people think they're fine to drive, but the research is crystal clear. Marijuana impairs your reaction time, your coordination, and your judgment, significantly increasing your risk of an accident. This is when your body or your mind is screaming at you to stop, but you don't. You have a nagging cough that won't go away, but you keep smoking. Or you notice that weed is making your anxiety or paranoia worse, but you keep using it. Sometimes in a twisted attempt to treat the very anxiety it's making worse. This shows the power of the disorder, when you know it's hurting you, but the compulsion to use is just too strong.
Tolerance is simple. Over time, you need more and more cannabis to get the effect you want. That single puff that used to do the trick now takes half a joint. Or you find yourself moving from regular flower to high-potency concentrates, like dabs or oils, just to feel that same high. This is your brain physically adapting to the constant presence of THC. Your cannabinoid receptors are downregulating, becoming less sensitive, and demanding a bigger dose for the same old response. It's a classic sign of dependence. This is the sign that completely shatters the myth that cannabis isn't physically addictive. When someone who uses heavily, and for a long time, suddenly stops, they can go through a very real and very unpleasant withdrawal. Symptoms often kick in within the first week: irritability, anxiety, insomnia, bizarre dreams, loss of appetite, and restlessness. You can even have physical symptoms: headaches, sweating, and stomach pain. This withdrawal syndrome is a huge reason people relapse. Using again makes the awful feelings go away, at least for a little while.
Okay, we've been through all 11 signs. What now? According to the DSM-5, the number of signs you identify with over a 12-month period gives us the severity. 2 to 3 symptoms? That points to a mild cannabis use disorder. 4 to 5 symptoms? That suggests a moderate disorder. 6 or more symptoms? That indicates a severe disorder. One of the biggest reasons CUD gets underestimated is because the withdrawal isn't seen as life-threatening, the way it can be with alcohol or opioids. But that doesn't make it easy. The psychological symptoms, the anxiety, the irritability, the low mood, can be brutal and last for weeks, making it incredibly hard to quit. And let's be real, the game has completely changed. The weed from the 90s is nothing like what's out there today. THC potency has gone through the roof, with some concentrates hitting over 80% THC. This isn't just about a stronger high, it's about a much bigger risk. High-potency products are linked to a greater chance of developing dependence, paranoia, and even psychosis, especially in younger people whose brains are still developing.
If we boil it all down, the line between a habit and an addiction is defined by one simple word: consequences. When your use starts causing problems in your life, with your health, your job, your relationships, and you keep using anyway, you've crossed into the territory of a disorder. These 11 signs are the clinical map for figuring out when that line's been crossed. Cannabis use disorder is a real medical condition, not a moral failing. It's a spectrum, and figuring out where you might be on it is an act of self-empowerment. If any of this resonated with you, please talk to someone, a friend, a family member, a doctor, a therapist. You are not in this alone. Millions of people are in the same boat. I'd genuinely love to hear from you. Drop a comment below if you have a question, or if any of this felt familiar. Sharing your story can be healing for you and might just help someone else feel a little less alone. Thanks for taking the time to learn with me. Be well and be kind to yourself.